Coronavirus, how it spreads and how to protect yourself and others. How this virus spreads. Person to person spread. The virus is thought to spread mainly from person to person, between people who are in close contact with one another, within about 6 feet. Through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled into the lungs. Spread from contact with contaminated surfaces or objects. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their eyes, own mouth, nose, but this is not thought to be the main way the virus spreads. How to protect yourself and others. Clean your hands often. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place, or after blowing your nose, coughing, or sneezing. Need a timer? Hum the happy birthday song from beginning to end twice. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Let's wash hands together. Step 1. Wet hands with water. Apply enough soap to cover all hand surfaces. Step 2. Rub hands palm to palm. Step 3. Rub back of each hand with palm of other hand with fingers interlaced. Step 4. Rub palm to palm with fingers interlaced. Step 5. Rub with back of fingers to opposing palms with fingers interlocked. Step 6. Rub each thumb clasped in opposite hand using a rotational movement. Step 7. Rub tips of fingers in opposite palm in a circular motion. Step 8. Rub each wrist with opposite hand. Step 9. Rinse hands with water. Great! Avoid close contact with people who are sick. Put distance between yourself and other people. Remember that some people without symptoms may be able to spread the virus. Keeping distance from others is especially important for people who are at higher risk of getting very sick. Stay home as much as possible. Engage in schooling from home whenever possible. Avoid social visits and social gatherings in groups of more than 10 people. Stop Emma in a safe distance to other people. Press stop before you are too close. You are good at social distancing. Always keep 6 feet away from others. Cover coughs and sneezes. If you are in a private setting and do not have on your cloth face covering, remember to always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw used tissues in the trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol. Let's cover coughs and sneezes. Great! Great! Don't forget to always cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. Cover your mouth and nose with a cloth face cover when around others. You could spread COVID-19 to others even if you don't feel sick. Everyone should wear a cloth face cover when they have to go out in public. For example, to the grocery store or to pick up other necessities. The cloth face cover is meant to protect other people in case you are infected. Do not use a face mask meant for a healthcare worker. Continue to keep about 6 feet between yourself and others. The cloth face cover is not a substitute for social distancing. Let's wear a cloth face cover together. It should cover your mouth, nose, and chin, with the colored side facing outwards. Remove a used mask, holding only the ear loops. To be effective, change your masks regularly. Wash your hands with soap and water. Continue to keep about 6 feet between yourself and others. Clean and disinfect. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. Let's clean and disinfect together. Great!